This is Alex. He's not comfortable with the cameras, but he still wants to share his experience. His illness began with treatment for malaria. He sought treatment and completed the 3-day dose, but saw no improvement.
I started coughing, had fever, difficulties in breathing.
He went for a check, and in October 2012, Alex was found to have a combination of pneumonia and tuberculosis.
I was put on pneumonia treatment for 1 week. That one cured. Then I started the normal first-line treatment for TB from Kiswa Health Center.
Unfortunately for Alex, he was found unresponsive to the first-line drugs.
Rifampicin and isoniazid. If at gene expert level we find rifampicin resistance, then we presume that this is most likely an MDR patient.
According to Dr. Stavia, the coordinator of MDR-TB for the National TB and Leprosy Program in the Ministry of Health, multi-drug-resistant TB is mostly man-made.
The side of the patient not adhering to the treatment, the side of the health worker not taking through the patient properly through how the TB treatment is going to go about, then the supply of drugs, if there is an interruption in the supply of drugs.
We have had about 130 patients in total, cumulative, in Mulago Hospital, but we're not able to admit all the patients. So most of it, because our bed capacity is 39 beds, so most of the time we admit patients who are very sick, or patients who have socioeconomic issues. Maybe they don't have a place to live.
In Uganda, the known number of patients is estimated at 300. Multi-drug-resistant tuberculosis, or MDR-TB, good enough in this country, can now be treated, where before in the past, about 2 years back, this was impossible. Patients were just there waiting to die.
I remember I could not walk, my legs swole. I once even used the wheelchair, couldn't stand, but that was like for 2 days. But I recovered my strength after getting that treatment of MDR.
Before the medicine, his family helped soothe his pain with herbal medicine. He now feels better though. 26-year-old Honest is another patient, grateful for the drugs, not just for herself, but for her child as well.
We checked to see whether they have sputum converted or not. And as we speak, she's sputum negative. When the baby came, the baby was 4.5 kilograms. That was in October. Currently, the baby is 11 kilograms. Yes, and the baby is doing very well. Even the mother, because sometimes we note our improvement by weight. Is the patient picking up on their weight? When Honest came, she was 32 kilograms. Currently, as I speak, she's 46 kilograms.
But this is a rigorous treatment and it requires discipline. Alex quitted third year at university to concentrate on the treatment.
13 tablets every day for 2 years, and I was put on injections for 7 months every day. You only rest on a Sunday. Yeah, they inject you for 7 months. But lucky enough, it converted to negative by month 4.
We give all the treatment for MDR-TB under direct observation by a health worker. So all the drugs you take throughout the 24 months, the health worker must see that the drug has been taken.
We see them on a weekly basis. We provide them with food and other nutritional supplements, like meal, porridge, because they do need the nutritional supplements.
Should a patient default on their drug uptake, there are consequences. They could very easily pick up on more dangerous strains, including extensively drug-resistant TB, XDR-TB, and totally drug-resistant TB, TDR-TB. Though not recognized yet by WHO, TDR-TB was first reported in India.
Once they diagnose you with TB, please, the first-line treatment is very important. Because when you miss even a single day, that's when it relapses and it comes into multi-drug-resistant MDR, which is deadly.
These strains come with very costly, less effective, few and inaccessible drugs.
There is surveillance for MDR-TB in country, and all the TB diagnostic and treatment sites are supposed to be on the lookout for possible cases.
The World Health Organization records show that in 2012, an estimated 450,000 people developed multi-drug-resistant tuberculosis in the world, and about 170,000 died in the same year. That is how serious the strain is. Florence Naluyimba, NTV.